The Ontario Ministry of Health has confirmed 2 deaths in this province have been linked to the listeriosis outbreak and plant-based milk recall. The recall applies to Silk brand almond milk, coconut milk, almond-coconut milk, as well as oat milk, and as well as Great Value brand almond milk. Health Canada says there have been 12 lab-confirmed cases of listeriosis across the country. 10 of those confirmed cases are in Ontario, with 1 in Quebec and 1 in Nova Scotia. 9 people have been hospitalized. The recall was announced earlier this month, but health officials say some people became sick as far back as August of last year. For more on the effects of Listeria, we're joined by infectious disease specialist Dr. Isaac Bogosh. Thanks for taking the time to speak with us. Let's talk about this disease. What are some of the symptoms and how can it infect the body? What are the consequences?
Yeah, so this is a really unfortunate outbreak. It's very sad to hear about the people who have succumbed to this illness. Listeria is a bacterial infection. It's known to be associated with foodborne outbreaks. Sometimes it can be in deli meat, sometimes in dairy products. The vast majority of people who get Listeria will have more of a mild to moderate syndrome of mostly diarrhea or gastrointestinal symptoms. But in people who are on the older end of the spectrum, the younger end of the spectrum, people who are immunocompromised, and pregnant women. Those are 4 risk factors for severe infection. The bacteria can get into the blood and cause a sepsis syndrome, and it also has a predilection for impacting the brain and the area around the brain, so it can cause a very severe meningitis. So it can be a very severe infection. I think when we hear about cases like this, you mentioned that most of these cases that were identified were found in hospital. That's because they were sick enough to come to hospital. There's likely many more cases of people who were impacted with this Listeria who are on the mild to moderate end of the spectrum of illness, who might have had a self-resolving illness, but who never made it to medical attention, so weren't counted. So very important that people are aware that this product or these products might have Listeria contamination in them. And if, that's that old line, when in doubt, throw it out. Make sure that those products aren't in your fridge anymore, so that you don't put anyone at risk or yourself at risk for infection.
Obviously, a big tragedy when we hear that, 2 people have died as a result of this. In terms of the actual confirmed cases, we're talking 12, which is not a very large number when you're talking about a country of 40 million. But what are your concerns moving forward, especially for those people who might have some symptoms and they might not know that they've been infected with this disease?
Yeah, certainly if anyone has it, if anyone feels unwell, if anyone has symptoms, or if anyone's concerned about this issue at all, it's important to speak with a healthcare provider. And I appreciate that it's sometimes challenging to access healthcare in Canada. But this can be a very severe illness, especially in people who have risk factors for severe infection: older individuals, younger individuals, immunocompromised individuals, and pregnant women. So it is important that if anyone might have consumed these products and has any symptoms, that they go seek medical care. On the other hand, too, as you point out, there's about a dozen identified cases so far. Those are the ones that have come to clinical care that have been identified. Very likely there are many more cases of this, but in people who have milder symptoms.
You made a point earlier. I want to circle back. Oftentimes Listeria is found in meat production, in cold cuts and stuff like that. But this is a plant-based milk recall. What does that tell you about how this infection started? Is there any kind of background you can kind of point to that might have led to this outbreak?
Very difficult at this point in time, but usually the bacteria is introduced at some point in the food processing chain, and there's a contamination at some point along the line. And you can be sure that the companies that produce these products are having a large internal investigation and certainly are attempting to quell this outbreak at the source. Unfortunately, we do see Listeria outbreaks not infrequently. Usually they're not on this scale, but we certainly have seen Listeria outbreaks before. And the key thing here is pulling the product, ensuring people are informed if they have been possibly exposed to this, and providing quality medical care for people that do come to medical attention.
Infectious diseases specialist Dr. Isaac Bogosh, we appreciate you taking the time to talk to us while on vacation. Enjoy it.
My pleasure. Thanks.